So we have seen that in last few exams, like maybe Jeddah, Pakistan, one particular topic is very favorite and common for the UK for the RCPCH. That is rashes, skin rashes. So they at least one or two stations you will get that scenario, maybe either maybe video station or communication. They will ask you about the rashes. So and second thing, uh, cases are repeated, recent cases are repeated, so you must, if you are going to appear in next 1 or 2 months, then you must be familiar about the last 3 months or last 6 months recalls. That is very important. Those recalls which are very new or very rarely asked, then they will repeat it. So it is very common practice. Recently we had seen one case of nephrotic syndrome with exposure to varicella. So we will do that case today. And then one more case. Both the cases are related to skin rashes. So anybody who is interested to do the first communication scenario? Dr. Mohammad Niaz, could you please read the scenario?
Okay.
Hmm. Please read loudly.
Okay. Talk to Mrs. Monica for her daughter Julie, who is admitted for nephrotic syndrome and is on steroids. She has come in contact with a patient chickenpox while playing. That
Okay,
patient
patient,
developed rashes next day. Talk to Monica regarding treatment to Julie.
yes. So this is chickenpox patient. I will just correct this. In fact, this patient developed rashes next day. So that they both were playing together. There were no rashes, but next day we found that this patient is having rashes. So that's why you need to talk to the mother. So you have 3 minutes, and we will start immediately.
Okay. Hi, Mrs.
When is your
Monica.
exam, Dr. Ma'am? Okay.
November 24th.
Okay.
Can I start?
Yes, now start.
Okay. Hi, Mrs. Monica. I'm Dr. Mohammed Nias, one of the pediatric doctor here. Is it a good time to talk to you?
Yeah, doctor. I'm here for my daughters.
Okay. Okay. Thank you for coming here. Do you want anyone else to stay with you? I want to talk regarding Julie.
No, doctor. No one is there. Is it something serious, doctor?
Actually, I want to talk to you regarding Julie, who is having nephrotic syndrome on steroid. And I came to know she has contact with a child who has got chickenpox. Is it right? Do you know about this?
Yeah, doctor. Yes, she was playing with one of the patients
Okay.
that
Yeah.
was next to bed.
Okay.
And next day I could see it just yesterday only. Yesterday evening that child has developed some rashes. Is it that chickenpox, doctor?
Yeah, exactly. That is a chickenpox rash. Yes, she has got. Um, so what has happened is Julie is
Mhm.
on steroid. You know that steroid is it causes immunosuppression. That means their immunity is less. So when they are exposure to a child who is having chickenpox, they are more prone to get infection. So there's a chance that Julie will be suffering from chickenpox in future. I mean, in a few days' time. So what
Oh
we
my
want to
God.
know is,
Oh
yeah,
my
yeah,
God, doctor, what are you saying? This is really dangerous, right? I heard that chicken pox is very dangerous. Sometimes the children can have brain infection because of that.
yeah. I understand your worry. Um, Actually, it's a dangerous illness if it is affecting the brain, but
Mm.
there are treatment available.
Okay.
Since we have come to know that she has exposed, we have prophylaxis that is called that we can prevent the infection so that she'll be fine. Okay, is that
Oh,
clear?
doctor. Yeah, doctor,
Yeah.
but what medicine you are planning to give to her, doctor?
Yeah, we can have we have a treatment. We can start on immunoglobulin, or we can give vaccine, varicella vaccine, whatever. It will be beneficial for Julie since she's on
Okay.
steroids.
Okay, so doctor, that will be very painful injection.
Painful. Usually, there's an injection, very mild pain. Usually, any injection cause pain, and we will make it the area less painful with a small needle, so it won't be hurting much. Julie, she'll be fine.
Yeah, but doctor, I heard that when you give vaccine or some injections, the effect will start after 3-4 weeks, and so but till then my child is safe from chickenpox, Dr. Julie.
I didn't get clear.
Yeah, doctor, I heard that when you give vaccine, the protection
Yeah.
starts after 3 to 4 weeks, right? And
Yes.
so my baby will be protected for next 3-4 weeks from chickenpox. My baby, she is on steroids already.
Yeah, exactly. So in that case, what we are going to do is we are going to give antiviral treatment. Yeah, the name is called acyclovir. We'll start acyclovir for her, Julie, and that will protect during that period. She will not be able to contract the illness. So that's a
Okay.
plan we are going to do. Yeah.
So doctor, how many days?
Duration will be around 5 days. We will give, and every 5 to 6, every 4 to 5 hour, 4 to 5 hourly, we have to give the tablet. It will be continued for 5 days.
Yeah, doctor, but is there any side effects of the medicine? That medicine?
Side effect, yeah, of course, there are side effects available, but the side effect is minimal when we compare to the benefit and risk ratio. We have to think about Julie's protection, isn't it? It will, if the disease contracted, she'll be in trouble. So we have to protect her. So side effect will be very minimal usually.
Yeah, but doctor, my baby's kidney is already suffering, right? She's having
Okay.
nephrotic, kidney condition, and this acyclovir is harmful for the kidneys.
Exactly. Very good question, actually. Acyclovir is have a side effect on kidneys usually, but
Mm-hmm.
when Julie is suffering from nephrotic syndrome, and we know her creatinine level, and we know her renal function level, everything we know. So according to, we can adjust the dose. We have a protocol. So the same dose will not be given for Julie. We'll adjust the dose according to creatinine function, so that we will be doing it carefully, and we'll be monitoring her renal function as well. And we'll give hydrate Julie during the process of treatment, and we'll be monitoring her. And daily we'll be monitoring her renal function, and we'll let you know if she is deteriorating. Most probably, it will be okay. Is that
Okay, doctor,
okay?
but
That's clear?
that
Yeah.
will you give through the blood tubes or through the mouth, doctor, medicine?
Yeah, we'll give through the mouth orally.
Okay, is it possible to give through blood tube? Because many times she is vomiting the medicines.
Yes, we can give. I in the cannula also. It's possible. Yes, we can give both way. If she is not taking orally, if she is throwing out or vomiting,
Six
we have
minutes.
alternation like
6 minutes.
we can give. Yeah, we can
Mm-hmm.
give orally.
So doctor,
So
you will give both the vaccine and medicine both to my baby so that she will be protected for a long time.
yes, of course, she'll be protected for a long time. Yeah,
So that vaccine you said, right?
yeah, exactly. So, Mrs. Monica, I will summarize. So,
Mm.
Julie has suffering from nephrotic syndrome on steroid, and she is immunosuppression, that is immunity low, and she has got exposure to a child who has got contracted chickenpox on the next day, and she was playing with that. So since she is immunosuppression, the immunity is low, we have to cover with antiviral treatment, that is acyclovir. Since she is vomiting, we are going for a injection for 5 days. And during that period also, we will give her vaccine also. So that vaccine action will take, as you mentioned, it will usually take 3 to 4 weeks duration. After that, she will be protected. During that period, to avoid further aggravation or some infection, we cover with antiviral treatment so that she will be completely protected. And we will be monitoring, since the antiviral treatment has a side effect on kidney, and already she is having nephrotic syndrome, there's a chance for renal function deterioration. So we'll be monitoring her renal function, we'll be hydrating her, and so that we'll update in during that period what's happening, Julie, and we'll be observing her. And is that clear, Mrs. Monica?
Yeah,
is that clear,
Doctor.
Mrs. Monica?
Yeah, it is very clear, Doctor.
Mrs. Monica, is that clear?
Yes,
Yeah,
Doctor. Yes.
And I will give you some details about this leaflet, and I have leaflet and on website link I can give you, so that you can leisurely go through that and get some more idea. And also, if you want more further clarification, we can meet another time. I'll arrange a meeting with you and we can talk leisurely. Is that clear? And if you have any more question, you can ask me.
Yes, Doctor, it is quite clear.
If you don't have any more questions, when you go through that link and reading, if you have more further question, you can come to me any time. Okay, we'll arrange another meeting, we can talk to her.
Okay, Doctor.
Okay, okay.
Yes, sir.
Thank you very much for coming, Mrs. Monica. Thank you very much.
Thank you, Doctor. Thank you so much. Okay, so 7 minutes left. You want to say anything? 7 seconds, sorry. Yeah, time up now. Okay, well done, Dr. Mahmood. I appreciate that you came forward and did the scenario. So, first of all, my comments I will give you. So
Okay.
whatever I comments I will give, that will for the betterment of your future, right? So
Okay, sure.
so don't feel otherwise. Don't take it
So,
otherwise.
okay.
Yeah. So here communications are just two-way, right? So here I was asking you the question, you were asking. This was not the involvement, like you are not involving me in the discussion, right? So it is not a history taking where you will ask the question and then I will answer. So this was just like I am taking the history from you or vice versa, right? So
Okay.
communication should be two parties involved equally, and that was lacking. Number one. Number two, I will start from I will scratch. So you said, hi, Monica. This is Dr. Mohammed. And are you Monica and mother of Julie or like this something, right? So you didn't, you were directly saying that you are Monica. Better you say that, am I talking to Monica, right? You should ask whether you are Monica or not, or mother of Julie or not, right? So instead of asking her identity, you were telling that, hello, Monica, how are you? Or hello, Monica, good morning. Correct? So that should not be there. Number two, I will point out small mistakes also. So you said, hi, Monica. So hi, Monica is not good word. Better you say, hello, good morning. Hello word is better. Don't say hi.
Okay.
Hi is very informal, right? Very formal. Then you were saying initially that we will give IVIG or varicella zoster immunoglobulin vaccine. You are not clear what you are going to start. When I said, doctor, are you going to oral medicine or this, and it will take 3 weeks to get the effect of this vaccine? Then you said, okay, we will give oral cyclovir. When I said, doctor, oral, she is vomiting, you said we will give IV. So you were not fixed on your treatment plan, right? So you cannot change your things. Here, in this case, the Julie was all right, comfortable. She didn't develop the rashes, right? So what is our latest guidelines? That when rashes are not there, we will give the oral acyclovir. If rashes develop, then we will give the IV. Correct? So that is the latest guideline. But you were giving vaccine. Vaccine, there is no role of vaccine here. You can give either varicella zoster immunoglobulin or simple. If it is not available, then IVIG. Right? So that was the previous guidelines. Now we see oral acyclovir or IV acyclovir. So oral when rashes not develop, IV when rashes develop. Is it clear?
Okay.
And you are
Clear.
teaching many jargons like you say mild pain, renal function test. Then you're saying immunosuppression. She is having immunosuppression because of steroids. Then when I said, doctor, is it something serious? So you didn't answer me correctly that it is serious or not, right? Then you said a duration of acyclovir 5 days, right? So it is 7 to 21 days, minimum 7 days, maximum 21 days we give. Uh, then you were talking very long, many sentences you were talking together. If you listen this recording again, you were saying me at least 6 to 7 sentences at one go. So that much I cannot digest as a mother, right? I cannot understand what you are saying. So you should be talking in a very small what we call pieces. And you should
Okay.
check my understanding also. So you checked my understanding, but when you were telling 7 sentences, 6 sentences at a time, that was very difficult for me. Then when I said, doctor, IV oral something, then you say both the things we can do, IV or oral. I said, doctor, IV or oral. You said IV, we can do both the things, right? Then you started summarizing. These are the few things. Then you started summarizing. So at 6 minutes, when I said 6 minutes, you said, okay, you are trying to summarize at the same time. You didn't ask me, do you have any other questions or concerns, right? Without asking that, you cannot summarize, because summary is not so important. First, you need to resolve the query or questions from the mother. Then only you will summarize. Summary is not at all important. If you do not have time to summarize, no need. Your marks will not be deducted in the mark in the exam. You started summarizing at
Okay.
6 minutes 20 seconds almost, and then your summary was lasting till 8 minutes 30 seconds. So summary was almost 2 minutes 20 seconds. So summary should be within 30 seconds, 40 seconds. Only headlines you have to summarize. You are summarize everything. Whatever discuss, you will summarize. So you should not discuss that. So you should tell to the mother, Mrs. Monica, today we have discussed about the chickenpox rashes with the patient had developed, and Julie is at risk of developing chickenpox. And for that, we will start a medicine called acyclovir. I have told you the side effects of that medicine, and blah blah blah. It's finished. Don't mention the what side effects I mentioned and what details. Only headings you have to mention. Then
Okay.
another thing I noticed that you are rushing. Means you are rushing to finish the scenario. Here we are not here to, here we are not for the any rush. We should first satisfy the patient. If patient is happy, then this scenario is successful. If patient is not happy, even after 9 minutes or 8 minutes, then what is the point, right? We have wasted our time. So that is very important in the exam. So remember, many things were there. Don't rush. Small sentences. Check understanding. No jargons at all. Only one jargon. That is also I would suggest don't go for that. So you should design renal function tests, creatinine and everything you are saying. So mother doesn't understand what is creatinine. I never heard what is creatinine, right? So renal function
Okay.
test, instead of that, many people say kidney function. I would still say don't go for kidney function test also the word. You say we have done some blood test for the kidneys, right? So that is the best way, blood test for the kidney. And they are normal
Okay.
like this. Okay. So you read the guidelines again and be fixed what are the clear-cut guidelines for such cases, because nowadays they ask this scenario was asked in UK also last year, I think 22 UK. This was repeated last week. So they all time they are repeating. Almost 99% cases are repeated. So if you all do recalls of last 3 years, then I don't think that uh, any new case you will find in the exam, right? So thank you, Dr. Mohammed, and this was the
Okay.
feedback.
Thank you very much.
Yeah,
Yeah.
welcome. Okay, so I request everyone, please mute yourself when you are not talking. That, and when I was talking to Dr. Mohammed Nias, there are all many mics were open, and I had to mute them. Right, so that was little disturbing. Please request, mind your mic. Okay, so Dr. Manal. Okay, so here latest guidelines are there, Dr. Manal, that if any patient who has come in contact, any patient who is on steroids, means he is taking immunosuppressants like maybe steroids or maybe other immunosuppressants. So he's immune system or body's immune system is very weak, so that patient can develop very widespread chickenpox, and if she or he develops widespread, then it can go to the different organs, so multi-organ failure and death may happen. So this is very risky for a patient who is on immunosuppressant, means his immunity is very weak, and that patient has come in contact with any patient who is having chickenpox. So 2 days before the rashes develop till the lesions crust. So when chickenpox is contagious or can spread to other patients, 2 days before the rashes developed. So this child was playing with the patient 1 day before the rashes developed, right? So definitely she has contracted the chickenpox or varicella. But maybe this child who is Julie, so this maybe she is immune to the chickenpox varicella, right? She may have received chickenpox vaccine earlier, or she may have antibodies in her body. We don't know, maybe because of natural chickenpox. So this child may be immune or not, but here you will start the acyclovir, number 1, oral. And if this child Julie develops rashes, then immediately you have to start IV acyclovir, so that the effect should start very fast. Otherwise, overwhelming infection can happen in this child, and then it will be very difficult for the doctor to control. So this is the final thing regarding that.
So
This same prophylaxis they can ask you for the newborn babies, right? So in that case, guidelines you have to read that 1 week before and 1 week after the delivery, if mother is having chickenpox, then baby should receive the two things are there. Listen carefully. If baby's suppose baby is immune, right? She has antibodies against the varicella. Then you will check the immune status of the baby. If she doesn't develop the rashes, this is old guidelines. I don't know what is the latest guideline for the newborn. This is 22 to 24 guidelines. So if baby is immune, means she has varicella-zoster antibodies, then no need to do. If baby doesn't have varicella-zoster antibodies in a body, then you have to give this what we call varicella-zoster immunoglobulins, or if not available, IVIG. If baby develops rashes, then you should start the varicella this acyclovir. So I think this latest guideline we need to check. I have not checked for the newborn. May apply for this babies also. Same guidelines. Maybe we start our acyclovir and then IV rashes develops. So I need to check on that for the newborn babies especially. Okay, but
Dr. Pankaj, we
yes,
will not give IVIG in this case.
in this case, IVIG not required. Because IVIG, what I believe that very costly, and you have to check the immune status, and so many headaches are there, right? So better you just check the baby, and when you will get reports, and it makes too much delay. So my view is also just start oral acyclovir. There is no harm in giving oral acyclovir, right, to such patients
How
in a
long? How long?
optimal dose. Hello,
Sorry, doctor. How long oral acyclovir? How many
7,
days?
yes, minimum 7 days.
Okay, and if we started oral acyclovir and child developed rash after that, so we will change to IV?
Yes, why not? Definitely. Okay,
Do you
but
have this
here,
guideline? Can you share in the group this guideline which say give oral acyclovir?
yes.
Please
Okay,
share in the group. I want to go
sure.
through it.
Yes.
Okay, Dr.
And,
Okay, Dr.
and this
Pankaj,
scenario is not a this scenario is not an angry mother, because she will not complain that why my child was playing with other child who got chicken pox. Your hospital didn't do any precaution. It can be an angry mother also, right?
Yeah, it can. You see, same scenario can be asked with different ideology or different what we can arguments, right? So we have to be ready with all the types of arguments. Mother can ask you anything. It depends on the role player also. It depends on the examiner also, how they prepare the scenario. Role caller, I mean.
Okay, Dr. Pankaj, suppose if
Yes.
the patient did not develop rashes, is it enough to check varicella immunoglobulins whether the baby has immunity or not? Suppose if the baby has immunity, shall we need to start acyclovir?
Yeah, still we should give the oral acyclovir, because what happens, we will check the immunoglobulins whether child is immune or not. That will take time, number one. Number two, in spite of the baby, suppose this baby has received vaccination in the past, correct? Still it is not 100% protective, correct? Suppose this Julie, she has received 1 year back chickenpox vaccine, but chickenpox vaccine is not 100% protective. Am I right?
Okay.
Yeah, so you can start with the oral acyclovir. If she develops the rashes, it means she is not immune. If she develops rashes,
If she didn't develop rashes,
then you have to give IV.
no rashes means
No, oral acyclovir, prophylaxis.
even though the baby is having antibodies.
Antibodies we have not checked in that patient,
Okay.
right? Okay, so we will go for the next scenario. But let me tell you, they are not so strict. Only basics should be clear. What to give, not to give. Simple. They will check your basics. If your basics are clear, then there is no problem. Like here, I don't know who was talking. Dr. Mohammed said that we will give vaccine also, we will give immunoglobulin also, and then I will give acyclovir also. And when I said doctor, vaccine will be effective after 3 weeks, then he said, okay, we will give the acyclovir. Like this, you should not change your stand. And you should give the correct information. That is again important. Okay. So this is, yes, this is the next case for Dr. Naresh Gulati. Please read the scenario.
Dr. Molly, mother of Sarah, who has developed rashes over the legs and buttocks. She has right knee joint pain and swelling. Her urine dipstick is protein 1 plus, and the RBC is 5 to 10. RFT is normal, blood pressure normal. Talk to her about diagnosis and management.
Okay, you have 3 minutes and we will start.
Yes.
Okay. So till he prepares, I will tell you something that I'm going to start new communication course in next 2-3 days. So if anybody is interested, already 2-3 candidates have joined. So if you are interested, you can join, and I will finish that in 6 weeks. 2 classes minimum or maximum 3 classes a week we will have, and I will teach you from the basics or scratch. So how to talk, what are the jargons, what will be the empathy, sympathy, what is your communication style, everything I will teach you. So those who are exam going in November and or December, January, this will be very beneficial. Already I have completed 4 courses on communication in last almost 5-6 months. So if you interested, you can contact me. Those who are not in my group, you can join my group. I give my number. So no one is there in the group, you can send me message. This is my number, WhatsApp number. You can ping me for the details. Yeah, course I cover usually 80 to 100 scenarios. Last course, I think I covered 90 plus cases. Last fourth course. Third course, I think I covered 80, almost 80, 85. Second course, I covered 80. First course, I covered 70 to 80. So I'm teaching almost all cases are covered. And recordings will be available for 7 days. Yes. Yes, please. So recordings will be available for 7 days. You can watch the recordings a number of times. And timing will be either 3 p.m. IST, that is 12:30 p.m. KSA, or it will be 7:30 p.m. KSA. 12:30 p.m. or 7:30 according to the candidate's choice. Maximum number of candidates saying we need 7:30 p.m. KSA, then I will go for that. or sometimes we can change. Depends. No classes on Saturday, Sunday. Very rarely. It may be there, but if all agree, then we do classes on Sunday. Otherwise, it is Monday to Friday. Days also we will fix as per the candidates. If they want Monday with Wednesday.
रोज रोज पार्टीज पे देंगे सभी पे
Sorry. Yes. Okay, Dr. Gulati, are you ready?
Yes, sir. Yes, sir.
Okay.
Should I start?
1 second. I will. The recording is going on. Yes. 1 second. Yes. Start.
Yeah. Hello. Good morning.
Yeah. Good morning.
I'm Dr. Naresh. I'm the child doctor working in this hospital. I believe I'm speaking to Mrs. Sarah, mother of Molly.
Yeah, doctor. This is Molly, mother of Sarah. Thank you.
Okay, how can I address you?
You can address me Molly, doctor. No issues.
Thank you so much. Today I'm going to talk to you regarding some of the concerns regarding your daughter Molly. Is it appropriate time?
Yeah, doctor.
Okay. So, do you have any update about Molly? What update you are having about her?
Yeah, doctor. My daughter developed these rashes. This is very scary. Or the buttocks and legs. Now, see, they are started on the hands also. And she's having very severe pain in the right knee joint. So it's very difficult for her to walk, and I'm too much scary. I think this is something very serious condition, doctor.
I can understand your worries, and I'm here to talk to you regarding all this.
Thank you, doctor.
So as you know, whatever actually we had come across through, like she's having rash, she's having this joint pain, and her dipstick, like urine examination reveals this lots of this the red blood cells, and there is a proteins also. This condition is usually it is called HSP, that is called hand-shell purpura. We just call it in a abbreviated way HSP. Have you ever heard about this condition?
No, doctor, no. Is it very serious condition, doctor? No, never heard. Name is very scary, doctor.
Yes, I can understand. You are so worried about this thing, but I assure you, need not to worry. And this condition is not that serious, and most of the children they come out with the treatment without any problem.
Oh my God, doctor, really, are you sure?
Yeah, I let you know what. As you said, I'm sure because I told you like most of the children they don't have any problem. They come out without any problem, but very rarely actually it happened to some of the children.
So, doctor, what complications she can have?
She can have the few of the complications like this pain in tummy, then pain in the joints, then maybe some problem with kidneys, like passing amount of a blood in a urine, amount of a protein in a urine, and she can have a bleed also sometimes from in her poo.
Oh my God, doctor, this is very dangerous. So, doctor, is there anything you can prevent all these complications in my daughter?
So as of now, actually, I can see she doesn't have like his blood pressure is normal, and her proteins is like only 1+, but there is this blood in this urine. So we are like to investigate, and we'd like to have a major follow-up. I mean, the follow-up in the next couple of months. Are you with me, Mrs.
Yeah, doctor. Yeah.
Molly?
So, would you like to admit her?
It's a very valid question. Like the admission, we have a certain criteria as when to admit this child. I mean, any of the child who is suffering from this disease. Like when the one of the criteria when he or she's having the pain in the joints, affecting the two joints, one, and second when there is a this massive bleeding in the poo, and then there's a pain in this. There is a good amount of urine is passing within in his poo, in his urine. So there are certain indications actually where actually admission is definitely required. But as I can, hello?
Yes,
Hello?
yes, yes, doctor.
As I can see right now, actually, she's having only pain in one joint, and her pain is like, if the pain is unbearable, definitely we would like to admit. Otherwise, actually, we have to follow up in a subsequent follow up with the CP and all.
Doctor, also any medicine you would give for her? See, she is having blood in the urine, right? Red color urine.
Mhm.
So, any antibiotics or antibug treatment you would like to give to her?
It's again a very valid question, Mrs. Molly. In fact, actually, this disease is not related with any infection. So basically, we don't require any antibiotics as of now. And this is like a problem which happens because of some problem of the infection, the very tiny this blood pipes which is in the kidney.
Mm-hmm.
So as of now, actually, the treatment part is all depends on the how the symptoms actually take care, and that's the only thing actually we can provide the treatment.
Okay, doctor. So no treatment required.
So as of now, if he's having for the tummy pain, actually we can give a treatment, like in the form of actually we can give some steroids, the medication which we are supposed to give for 2 weeks.
Doctor, she is complaining for the tummy pain today morning, doctor.
So in this case, actually, we can provide a treatment for 7 days, and we are supposed to give a very minimal dose of the steroids, which are the medicines that can take care of that this tummy pain.
Okay. 6 minutes.
Yeah. So, Mrs. Molly, do you have any other questions?
Yeah, doctor, she is having these rashes. So is there any medicine which I can apply over the rashes?
It's a part of the symptom of the disease. The rashes actually they takes a time to subside, and sometimes actually they take a like 1 to 2 weeks they settle down. And there is a no, because these rashes are generally non-itchy, so it doesn't give any problem. So actually that can take care of spontaneously.
Okay, thank you, doctor. Thank you, doctor.
So do you have any? Okay, sorry. Any other question from your side?
No, doctor, no. Thank you.
Okay, so can I sum up like what we discussed today?
Yes, doctor, please.
So the Molly actually she had come with an acute episode of this pain abdomen and tummy pain and the rashes, and the blood test actually reveals only the 1+ protein and this blood. And so I explained about the nature of the disease, which is called the Henoxian purpura. And as actually if this stamp says like she's having only this 1+, and so she requires a general follow-up with the ZP further. And for the tummy pain, actually she can, I'm going to prescribe you this steroids for 2 weeks. That will take care of. And we will have a follow-up for the next couple of months till the things are clear. And meanwhile, actually, I'm going to provide you certain leaflets actually so that it come across and you will have a better idea of this particular nature of a disease.
Yes, doctor.
I wish Molly a very speedy recovery, and thanks for meeting me today, and thank you so much and we are always here to help you out. Thank you once again. Thank you so much.
Thank you, doctor.
Time.
7 minutes, 50 seconds.
Okay, and one more thing actually I want to say to Molly, like sometimes, very rarely, this can happen to sometimes the kidney gets involved, but it happens very rarely. And but the only thing is this: you have to be in a very regular follow-up with the general practitioner, and you have to go for the blood pressure checked every monthly, and then you have to go for the urine statistics once in a week, I suppose. And then these all things actually are taken care of. Blood pressure is very important in this part.
Okay, doctor. Thank you so much.
Okay, thank you so much. Again, I wish him very, very speedy recovery. And thanks again.
Thank you, doctor.
Thank you.
8 minutes, 44 seconds.
What should I say now?
Okay, time up. Okay, thank you. Thank you, Dr. Skulat. Very nice. A good attempt. Let me start. So when you started, you met Molly. Molly was mother, and you met Sarah as a mother. So that was one mistake, but I will forgive for that mistake, no issues, because sometimes this is not clearly written over here. So you got confused. Here mother was Molly and daughter was Sarah. And I said, yes, doctor, this is Molly, Sarah's mom. But still there, still you are insisting that you are Sarah and daughter is Molly. So that was one thing. Then when I told that yes, doctor, she has rashes, joint pain, everything, you are repeating again my story. Yes, I know she is having joint pain, rashes, so you were wasting your time, right? Then you said, doctor, I said, is it something serious? You said, yeah, I can understand you are worrying about these things, right? So these things you cannot see irrelevant things, right? What is these things? Nothing. You should say whatever you want to say, like you worried? I know that you are worried about the rashes. I know you are worried about her health condition. Correct. So you were telling many words which were not relevant in this scenario. Then you said no need to worry. I had mentioned already in my previous sessions that you will never tell to the mother that you no need to worry. This is a very common mistake everyone does, because this is mother's right to become worried, right? It is her right to be worried, and you are saying don't worry. You should not say don't worry. You should give the solution so that mother will not be worried. Correct. Then you said, as I told you previously, or once you said, but why are you saying me? I told you previously. You are not giving, you are not obliging me, right? It is your duty to console me, give answers to me again and again. So when you want to give answers second time, suppose you feel their mother had already asked this question again, she is asking. It means there is some hidden agenda. So you should, if you want to give the same answer, but you should change your language and give the same answer, right? Then I said, doctor, can you prevent this? So I don't know what you answered. I forgot. Then when I said, doctor, can you admit my child? So you said yes, we cannot admit because there are some criteria. So you were telling me all the criteria. So if there are two joints involved, it's severe tummy pain, blah blah blah. So you were giving me the medical education. I don't need any medical education. So you should give the vague answer. Vague answer means generalized answer. So, Mrs. Molly, I can understand you are too much worried, but she doesn't require any admission right now. Her conditions, you see, is blood test for the kidney is normal, blood pressure normal. These are the two things you have to tell. No need to tell all the criteria. See, her blood pressure is normal and blood test for the kidneys are normal. She doesn't require, and she is eating, right? She's comfortable like this. So you should answer in that way. Then, you repeating. You were repeating many times. Actually. I remember you told actually at least 10 to 12 times, at least 8 times. Actually, this thing, actually that thing, and you said this disease. So you should not tell disease to the mother. Health condition, right? Disease is a very scary word for the mother. So, and actually this thing, actually that thing is very annoying to the role player. There is no meaning of actually that thing, right? Then I said, doctor, tummy pain is there. You said I will give the steroid for 1 to 2 weeks. I said just tummy pain, maybe because of dehydration, right? Not because of vasculitis all time. If it is severe tummy pain, then only you will give the steroids. I say, yeah, she was complaining today morning for the tummy pain. So I was talking about us. I was not so much curious about oh, my baby is having very severe tummy pain. She is not tolerating at all. So doctor, then that case you will give steroid. Steroid also you cannot get at your own. You need to consult your consultant. You need to take permission, right? Then you did not address the knee joint pain and swelling. It is given in the stem. She has right knee joint pain and swelling. So you did not give any medicine for that. You did not tell her any medicine. So hydration is very important. Pain, like she is having pain, so she should take paracetamol. She will give prescribe you. Then for the swelling, what you will give, right? So elevation or ice pack or whatever you want to give for the knee joint swell. So you did not address that swelling also. Correct. And then your summary was completed by 8 minutes 30 seconds something. Then you didn't give the red flag sign to the mother. You told that yes, if she has to do follow up with the GP, so weekly for the dipstick do weekly and monthly for the blood pressure with the GP, right? So you should tell the red flags also. You should tell if she found something like this, then you should contact the health visitor. You should report to the health visitor or come back to the emergency or like this, right? So you have to tell that if she develops abnormal movements like meningitis, or there is a blood in the poo, if she has blood in the poo, something coming out, very severe tummy pain. So these you are talking about the intersusception, indirect way, intersusception, severe tummy pain means vasculitis.
Pancreatitis.
Yeah, so all these pancreatitis also. So these red flags you have to give to the mother. This and treatment is paracetamol, and then hydration is very important to tell to the mother, right? For such patient. So what is symptomatic treatment? That is called hydration. So you need to give red flags, advice. So that is again important. So this is how you will complete the scenario, and you have to involve the mother. You're involving mother. Initially, I could that initially 3-4 minutes was very good. 3 minutes. But you need to that this thing, that thing, this is vague answer, so that you need to be careful. Friends, I tell you this, the two scenarios which we have done for skin with rashes, they are very important in the exam. Nephrotic syndrome is also very important. So go through the most common cases list. I have one list in which most common cases I had prepared. So at least 40-50 cases are there, which is handwritten. So you can, I assure you that at least 4 to 5 cases you will get from that list. So if you wish, I can share in the group, so that at least you must be prepared, and those cases which are not in that list. So this list, preparation of this list will help you in other cases also, which are not there in that list, indirect way. So that will be useful for you. So these were my comments for today's this.
Thank you so much, sir.
Two cases. So remember this communication is practice. If you are away for practice for last 1 month or 15 days, then it will be difficult for you to be in that flow. So I would suggest that you continue, keep practicing with your friends in the group, and from wherever you had get the coaching. So same friends should be there in that group, and at least 3 to 4 friends. 4 friends are required. 4 people in that group, so that you can point out the mistakes. Yes, I show you scenario list. I will share 1 second. What are the messages? List. I will just I will give you the list. 1 second. I mean the list, and that what we call group link I am sending you here only. You can ask your friends to join the group also. Where is it? Just a second. Yes, I got it. So you got the link, and I will share the list with you. That is 40-50 scenarios, very common. And again, I'm telling you, friends, go through the last, because this is very, everyone is resistant to that thing, that he or she will not go for the last 6 months scenarios. So that is very important. I was thinking to start this crash course in which all recalls will be there. So that was I was thinking, but I have not finalized yet. In that, I will teach only recalls, right? So last, you can say 1 year recalls, 2 year recalls, practice of those recalls. Because if you prepare at your own, that is little difficult. Let's see if it's work out. Otherwise. Okay, thank you, friends. I will share this recording on the YouTube and will send the link in the group. That will be there for 3 days or 7 days, you can say. 7 days I will keep this recording in the YouTube. You can watch what mistakes they did, and you can ask me if you have any question in the group, in my group. Okay. Thank you for joining today. And if you wish to join my course, let me know by tomorrow or today, so that we can start in 2 days. Thank you.